opportunity to welcome you to this particular webinar. And we are glad that you you have taken an opportunity and your time to join us in this particular webinar. In this particular session, like we had suggested or asked before, informed you before, we are going to be looking at the Social Health Authority, understanding that there has been a shift or a navigation from NHIF, the former NHIF as we all know it, to the Social Health Authority, or together with SHIF. SHIF is Social Health Insurance Fund, if I'm not wrong. This comes with various challenges. This comes with various issues, both to the employers and to the employees. And as Q Sourcing Softech, a human capital management system, management company that basically gives services to different areas of the HR practice, we thought it wise that we would help our viewers to understand basically the navigation, how to move from SHIF, from NHIF to SHIF or to SHA, and the impacts that it may have. So in this particular session, I'm joined by two experts, Mr. Duncan Dungu, who is our HR business partner at Q Sourcing Softech. He's going to help us understand the HR perspective and the issues that may come with this particular movement or shift. I'm also joined by Mr. Zach Alakonya, who is a legal practitioner with a lot of expertise in labor relations and just things to do with all the Employment Act and all those kinds of things. So the two gentlemen or the two panelists are going to help us navigate, answer questions that will help us have a better understanding. To our viewers, we know and understand that you may have questions. I would encourage you to put down your questions on the chat box. And after maybe the first 40 to 45 minutes, then we will take those particular questions and answer them. So as we move on, I would encourage you, if you have a question, you have a follow-up question, please feel free to put them on the chat box. We also want to appreciate the Blue Company Secretariat that has also helped us to put this together. We have worked in conjunction with Francis and the team, so feel appreciated and feel most welcome. Without wasting a lot of time, I think maybe my first question to set the pace running would be to Mr. Zach, Mr. Alakonya.
Yes.
Please help us understand, because I believe our viewers already know what NHIF is.
Yeah.
Please help us understand what SHA or Social Health Authority is, and what is the SHIF part of it, and what is the difference between what we are talking about now and NHIF.
Right. Thank you so much, Eric. That is a very interesting question. But in order to better understand it, and I do believe that throughout the whole session, we are going to be able to run through the various differences.
Correct.
So it cannot be really broken down in one line. Yes. But how I want to answer that question is, first of all, to understand the health sector history in the country.
Yes.
And why the move was necessary, or perhaps has been justifiably to be necessary.
Yes.
And for us to get that, you want to go back to the Kenya Universal Health Coverage Policy, 2020-2030.
Yes.
In this policy, it breaks down the entire health spectrum and how health is managed in the country. And this policy literally highlighted and brought about the major challenges about health coverage in the country.
Yes.
And that is hinged also on the 2010 Constitution, together with Sessional Paper number 17 of 2017. These were a historical document or policy frameworks that had analyzed the gaps that were existing with the old model. So for a start, the National Health Insurance Fund, NHIF, is a model that was created in 1966.
Yes.
And has been amended severally over the years to try and increase health coverage across the country. for some time, not just to this government, but even in past regimes, it has been argued that it is not effectively able to reach the wide areas and the whole scope of the country. And the question has been, how can we get more people in the country under the health framework and health coverage and health insurance?
Yes.
And with the emergence of the Constitution 2010, Article 43, obligating government to create and ensure that it provides health care to its people, entitling its citizens to comprehensive health coverage, then the conversation of universal health coverage starts.
Yes.
And universal health coverage is, how can we create a framework that is a health system that is affordable, that reaches every citizen, that has a lot of quality. It has the quality in the services rendered,
Yes.
and it reaches far and wide. Hence, we arrive at the Social Health Act.
Okay.
So the Social Health Act has been enacted to try and address the gaps identified in the old model of NHIF.
Yes.
And those gaps is to ensure that there are funds, and you will see as we continue to discuss,
Yes.
the various health funds that have been created across the board, diversifying the various health categories
Yes.
within which are being covered
Okay.
under the new model.
Okay.
So we'll be able to see the differences as we go along.
All right. Thank you so much. And that the UHC aspect is quite interesting. Huh?
Yes.
And so that basically leads me to the second question that I would probably want you to address and talk about.
Yeah.
We all know, we all live in this country, and we know the history of NHIF.
Yeah.
You know, the issues that people were having when they are going to hospitals, the limitations that it had, you know, people are not able to probably, you go to hospital, for example, NHIF takes a lot of time before they approve. Most probably certain hospitals, you're not able to be covered by NHIF. So what you are saying is that it was necessary for this regulatory change and shift. So please advise our viewers or talk to our viewers on why it was necessary. And now that you have alluded to the gaps, what are the gaps in NHIF that SHA is probably looking to fill?
So whether or not it was necessary is still a subject of debate, because there have been arguments that the NHIF could be improved because certain aspects of it were still working.
Yes.
But then we have a situation where there were questions as challenges relating to corruption, challenges relating to manpower, challenges relating to how the system, how effective is it?
Yes.
How effective is it in terms of health coverage?
Yes.
You will remember in the last about 10 or so years, there have been a lot of improvements in trying to get different classes within NHIF to try and improve services and NHIF.
Yes.
And I think a lot of positive feedback has started coming through in terms of just how the improvements have helped, you know, because initially, or rather the structure of NHIF, just to make clear, understand, maybe this is the first difference with the shift.
Yes.
Either the structure, as it were, it allowed for registration for anyone from 18 years and above,
yes,
and contributions ranging from 150 to a total of 1,700.
Yes.
So it was just a blanket categorization. Over the years, there have been improvements that have come to try and introduce new classes and new clusters of the protection. So there are still arguments that, yes, there was still room. But now we have reached a situation where now we do have new health system and new health framework that now has broken down, now introduced cluster of coverages,
yes,
that now focuses on the side of, when we look at the various funds that have been created, yes, the primary health fund, the social health fund, and the emergency health fund, you will realize that it focuses on specific services, yes, that are designed to be so precise in their coverage. And so what are we saying? What we're saying is that we are already in the new model.
Yes.
I think it's about time we started understanding, which is why I actually also appreciated this session.
Yes.
It's about time we started understanding, okay, what does it mean? What are the implications? What do we need to do? And we shall be able to dive into them and be able to essentially break out what it means. Still early days. I think we are like 3 weeks after rollout.
Yes.
Because the 1st of October, after the Court of Appeal made its decision.
Yes.
And therefore, so it's still early days, 3 weeks, and there are still those teething challenges that we're going to experience.
Okay.
But we will be able to delve and just see what are the various categories that are coming.
Brilliant.
Yes.
Allow me to bring in Duncan, who is a HR practitioner. And a lot of questions have been asked out and about. And from what Zach has said, that SHIF is just one of the components of SHA, of this particular framework, or this particular, if I may call it that way. From a HR perspective, what is the main difference between SHIF and NHIF, taking into account that SHIF is a component of SHA from a HR perspective?
Okay, thank you, Eric, for that question. So one, of course, I would look at it from an employee perspective as an employer. One would be that, of course, there's going to be a significant change in the employee take home in terms of the deduction, especially for high earning employees. Secondly, looking at it from basically from a coverage perspective, is that basically SHA is going to be more comprehensive in terms of it is going to be a bigger kitty in terms of the government program as compared to NHIF. Secondly, I believe is going to address the issue of, as earlier noted, that majority of the NHIF contributors, while sometimes, especially the ones who are not on the payroll, they would, of course, make sure that they only contribute around the period where they require services from NHIF. Like now, a very good example would have been for maternity services. You would find that users would only contribute a few months before they required that particular service, which is one of the few services that was considered in NHIF to be very successful.
Yes.
Secondly, SHA is targeting a bigger market penetration.
Yes.
As compared to NHIF, which had a lower penetration of around 20%. And the last one that I could easily pick is that the model targets to approach households as compared to NHIF, which was mainly individual, had targeted the individuals. And therefore, this would probably lead to a better management of the kitty going forward.
If I hear you well, so basically what you are telling, employees across the country is that they should be prepared to take a hit on their pay slips.
Yes, definitely, because the 2.75 for majority of the employees, especially high earning employees, would be significantly higher than basically what the deduction was in the old NHIF.
Okay. Now, taking that into account, from an employee and employer perspective, if I hear you well, and I hear also what Zach said, then we are looking at, a program with more benefits to the employees, for example, because that is our main area of focus. Now, to the employer or to the businesses around Kenya, how then should they approach, employee health benefits, especially when you are onboarding employees, when you are bringing employees on board, and you know that this contribution is going to be there with a wider coverage. How should employers or businesses approach the health benefits for their employees when negotiating with their employees?
Okay, thank you, Eric. I believe this is a very interesting topic for majority of the employers, by the fact that this has always been a contentious topic, especially during discussions or negotiations between employees and employers. So one, I would say that the first step would be for employers to look at it positively and actually believe that if at all the government comes through with probably the implementation plan as they have communicated it so far, despite it not coming out very clearly, is that we might end up as employers having a standard health cover across basically the country or across all the employees, which of course has always been a challenge by the fact that you find a very small percentage of the Kenyan employers who are able to provide a health insurance cover for their employees. And therefore, I believe it's a positive. However, I believe the employers should also find a solution around addressing the deduction basically in the take home of the various employees, because I believe when an employee will be discussing this particular topic,
yes,
of course they'll be looking at what they are losing from the beginning, or the current employees who have already been employed. They will of course be looking at the significant reduction in their take home.
Okay.
So I think those are the areas that employers should focus on while engaging employees.
All right, brilliant. Back to Zach.
Yes.
Now, because this is an act of parliament, and basically it's a legal framework then that has to be adhered to by all employers, and I think that is the expectation also from the legal authorities or from the government. What therefore would be the immediate legal and compliance obligations by the employers with the enactment of SHA?
Okay. So first, how we advise our clients is that we look at what the law is saying.
Yes.
And the law in this case is the Act itself of 2023, number 16 of 2023, the regulations that of 2024.
Yes.
And upon the determination of the finding, the Court of Appeal decision, that is the Court of Appeal decision that came out, I think, sometime around late September.
Yes.
Which now essentially allowed the implementation and the rollout of the Social Health Act. Then from 1st of October, it was mandated that all employers must register.
Yes.
The period in the regulations, that is around Regulation 17,
yes.
The employers are given around 60 days, within which they are required to comply with the registration process. Not just the employers, everybody for that matter, including employers.
Yes.
The website for the Social Health Authority is already up.
Yes.
And when you look at their portals for registration, but also in the regulations, there are forms that are required to be filled through which registration is done.
Yes.
Initially, from the 1st of October, I think NHIF ceased being in operation.
Yes.
But at some time along the way, they decided that they can run concurrently as the transition period runs through.
Yes.
So the first port of call, it is the compliance question, which is expected that employers must, or every single person, both employers and employees, must register.
Yes.
with under the new plan.
Yes.
And start contributions as at the end of this month. Yeah. So of course there are penalties for failure to comply with the registration requirements. They are graduated 2% the first within the period within which someone was expected to make the contributions.
Yes.
And 2 million where they are found to still be in continuous disregard of the requirement for registration. So the first thing that I think everyone must do is to ensure that they are updated and their systems are updated. I don't know if everyone got this. On my end, I got a message telling me my information had been updated. So I'm not sure if I did it myself or someone else did it, or they have tried to intermarry the systems. Because one of the greatest things that has been told about SHIF is the use of technology that they are going to deploy in order to reach a wider base.
Yes.
So that is one of the things that we'll be telling people to make sure that they are compliant.
Okay.
Yeah.
I think fair enough. So one of the things that you have alluded to, and basically one of the challenges even for the employers, we were having a discussion with Duncan earlier on how then we can be compliant, is the fact that there was a communication. I think there was a USSD code that you were supposed to dial. I tried it myself. I got a message back on my SMS. And then when I logged into the SHA portal to try to update, I faced challenges. I have actually not been able to do that until at this particular moment. Now that brings me to the question of the legal risks or the compliance risks, because the government expects that at the end of this month, the deductions are going to be effected across across by all the employers, and then they're supposed to remit to SHA. But now Eric is not updated on SHA. Yes. So what are the legal risks on the businesses or the employers that will not be able to remit the deductions as of end of October? The government.
So of course, the first thing is the penalties that are there. At 2% of the expected remittances. But however, the first schedule of the Act provides for transitional provisions, makes transitional provisions. These provisions are meant to be utilized during this process of transitioning. Remember, also in the regulations, the period given for registration is 60 days. So there are these things that are put in place to cover, for instances like these ones, where the systems are not yet up to task. Remember the new system being rolled out. The amount of data that is receiving right about this time
is quite huge.
It must be crazy. And as such, the drafters were conscious enough to say that let us give it a period of time. In fact, in my view, 60 days is too little a time to give for such a major shift. Most of the time, whenever systems are changing publicly, as such public systems as this one, a transition period, a recommended transition period is 2 years. I will give an example when we were transitioning to devolved system of governance. There was even a transitional authority to manage the transition and transfer of assets and responsibilities. These are some of the gaps that are going to keep emerging all over the place. So that this period is meant to address and deal with system failures, with the lack of proper information, because a verification exercise has to be conducted. You don't know if some people may have registered that gave wrong information, and at the same time, the health side of things, the service providers, the health service providers side of things, need to be onboarded as well. They need to be onboarded and be onboarded onto the system. So there's so much happening at the same time. What we can tell the employers is the organizations, businesses, employees, and everyone may be listening to us right now, is that the minute you encounter a problem at the registration, cover yourself. First things you do, write a letter or an email, communicate to the authority that we are experiencing challenge 1, 2, 3, 4, 5, and we therefore seek assistance or whatever. It's just a process of coverage. However, the law has put in safe clauses that allow a transition period within which all these challenges are going to be dealt with.
Brilliant. If you look at, I don't know how to call it, is it an NSSF Act? I don't know whether there is an act like that. The contribution is from both ends. From both the employer and the employee. Tell us about SHA and NHIF. Is there an obligation from the employer to contribute to this particular facility?
No. The only contribution that is contemplated is for SHA, the 2.75% has been paid at a gross. Gross salary of the employee. Now, what does that mean? Duncan has said that employees should brace themselves with getting a hit on their payslip. But that in itself is a problem under the employment law. Okay? So employers are going to have to start a process of engaging with the employees, particularly where the 2.75 would have an impact so as to lower the take home of this particular employee. Where that happens it will have infringed on the employment provisions of the under the Employment Act,
Yes.
in terms of affecting the salary of the employee without employee having had a say. One of the challenges that was mounted before the Court of Appeal and even the High Court, when all the health laws, there are several of them, the Digital Health Act, the Health Act itself, and this particular set of acts, was the extent of public participation.
Yes.
Yeah, whether or not there was sufficient public participation. The argument was that there was not sufficient public participation.
Yes.
And therefore people did not know what the impacts, the implications of this move was going to be. I'm sure that has been buttressed by the recent public participation involved with the impeachment, which most people agreed that was quite impressively handled.
Yes.
In as far as having people, bringing them there, letting them say what they need to say.
Yes.
And I think, for me, if you ask me, that's the kind of public participation I would have expected for such an impactful legislation as this. So the employers cautioned to do their mathematics with the payroll and look at the implications and begin engagements with these employees, because if handled carelessly, it will precipitate a situation where certain challenges may be raised by employees in as far as their salaries are being affected. Of course, there could be an argument, which is also sound under law for the employer, that I was effecting a statutory obligation imposed on me. So I'm not paying you less because I have taken the money. But I'm effecting a statutory obligation. So there's a sound argument there. But before you get me, hire me to defend you, making that sound argument, I would require you to open a file, pay me a few coins, and then I can advise you.
So at the end of the day, there's still going to be some cost implications.
So that is something that we cannot escape as employers. There has to be that conversation and look at the implications.
I think I hear you well, and then that means that employers like Duncan and all of us out there then need to be able to brace themselves in terms of how to support this process. And so that brings me to my next question that goes to Duncan. Now, as an employer and from a HR practitioner perspective, what kind of support do you think is necessary that employers and businesses and companies around the country need to give to their employees to help them better understand this particular transition, barring any legal issues that may arise there, and based on what Zach has said, which is an obvious thing, that it could take a hit on the pay slips of the employees. How best can employers help their employees understand this particular transition and support them during the transition?
Okay, thank you, Eric. I believe that's a very important question, by the fact that based on the simple engagement that we have had here and there with our employees, majority of the employees, of course, have demonstrated a vote of lack of confidence with SHA as it is right now. And I believe, of course, one of the main reasons why they are having this lack of confidence with the program is the fact that the public participation was not done well. Secondly is that the government has also probably failed to effect it appropriately in terms of the timelines and the normal way that you are supposed to go about effecting such a big program. A very good example that has been cited is that the digital system that will be using to execute this particular program was supposed to be rolled out in 2026. So basically, we are talking about 2 years before time that they have decided to roll out that particular program. In terms of testing, they have done it only in 2 counties. And I believe that those are some of the issues or some of the things that my employees have looked at, and probably they have felt this thing might end up failing. I believe there was also even some information out there that the system had crashed a few weeks ago, which is, of course, bringing a lot of lack of confidence from employees. However, in terms of supporting our employees, probably to be on board, in regards to this particular program. One is, of course, sparking these conversations as we are doing now.
Yes.
Secondary is having formal communication through our town halls, emails, and all formal communication that we have within the organization. This is simply because I believe that this is a good program, and mainly is going to probably relieve the employers who are mainly paying the private health insurance fund for or kitties for basically for their employees. Another important thing that probably I would add to what Zach was addressing is the fact that we need to make sure that we communicate these roles, and we need also even to develop and put in place some policies within the organization, so that a policy that will be customized to our specific organizations. And lastly, also adding to what Zach was talking about, I believe the government was also kind of strategic in addressing the issue of the hit on the pay slip, in terms of effecting some basically salary increments on the basic pay or on the minimum wages. However, when you try looking at that particular salary increment of 6%, of course, it is going probably to relieve majority of the subordinate staff from that particular difference in their pay slip. However, if you calculate up to the point of, let's say, somebody earning around a gross salary of 30,000 shillings, then it starts diminishing to a point where the high earning employees are not going to feel that impact of the salary increment, by the fact that they are not categorized in the category of the employees receiving that salary increment.
Thank you. I think that is fair enough. Our viewers, just want to remind you, those that joined us late when we had already started, if you have any questions, please put them on the chat box. We will have a time for Q&A where we'll be able to try and address some of those questions. Zach,
Yes, sir.
there is something that Duncan has alluded to,
Yes.
and this basically brings me back to the legal issues. So we have a scenario where Q sourcing has deducted, the 2.75% from Eric, and because of the technical issues in the portal and all these IT things within that particular SHA portal, they are not then able, because if you have to remit, then it means that my details, my profile needs to be properly updated. So if we go beyond the 60-day period, transition period that you talked about, you realize that we would still be having some teething problems at the end of the day. Then 2-3 months down the line, Eric's deductions have not been remitted to SHA.
Okay.
It therefore means that Eric cannot benefit from the services because he's not remitted.
Yeah.
But from an employee's perspective, my deductions have already been made. What are the legal repercussions, or for lack of a better word, how does then the employee stand? Where does the employee stand if he's denied health services because his profile or his account is not updated, yet the deductions have been made, and it is not the mistake of the employer nor the employee?
Okay. It has to be a mistake of somebody.
Yes.
Of course. So the obligation to ensure the individual account for any statutory deductions are set up, it's individual.
Individual.
Okay.
Yes.
The obligation for deduction is an employer-based, an employer-facing obligation. Okay. For all statutory deductions. KRA, housing levy that was now cemented yesterday, all manner of statutory deductions, the obligation to deduct is the employers. Yeah. Now, as where to remit is the government. Okay. So in this whole chain, there is where the obligation begins and ends. Yeah. So, for instance, if Q-sourcing was to discover that they are having a challenge in remitting the deductions for their employees, and it takes them 3 months for that discovery, we'll ask what have they been doing in the background. Like I said earlier, cover yourself. For employers, you have to ensure you cover yourself. Open channel of communication. consistently engaging and seeking for help and highlighting, because there is exposure. If you don't do anything and say this system is not working and therefore we are unable to continue and we sit and wait, you expose yourself to the 2% charge and 2 million penalty. So that at this chain, we must be able to be alive during this process of transition to ensure that we are able to make sure that we put the blame where it belongs. Now, Eric, just to perhaps maybe create some form of clarity around this act, the Social Health Authority Act, and the Social Health Insurance Fund, SHA. Now, there's a lot has been spoken about the Social Health Insurance Fund. Yeah, and that's rightly so, because this is the only mandatory fund that has been created under the Social Health Act. Yeah, but the Act creates 3 types of funds. Yeah, it creates a primary healthcare fund under Part 3 of the Act, covering sections 20 to 24. Yeah, where this purpose of this Act is basically to provide primary health care and preventive, corrective kinds of healthcare. However, curiously enough, I was just wondering, because some of the services provided under this fund are quite critical, but there is no mandatory registration under this fund. Okay. The second fund that is created is the Social Health Insurance Fund, SHIF, which is now the one that is really replacing NHIF. Yeah. This is under Part 4 of the Act. Now, SHIF is mandatory registration. It is the only fund where the Act says every Kenyan must register under this fund.
It's mandatory.
Mandatory. In fact, including children.
Whether employed or not, old, young, it is mandatory.
It is mandatory. My question actually was wondering, now children are not earning, who's going to pay? So parents, you better get ready to contribute further to for your child or the children, if you have 8 or 10 children. Pole kwako. So that fund is where the rubber meets the road. The Social Health Insurance Fund, and that is the fund that there's focus on how it's being implemented. That's the fund that is going as far as even dealing with incarcerated people in prison. That is saying that the Department of Correctional Services shall be the contributor for those people in prison. If you have a man or woman over 25 years living with you in the house and is not earning,
you are obligated
either you or him must make sure you contribute 300 shillings, a minimum of 300 shillings.
month on month.
Month on month. Yeah. Your children, like I've alluded to. So this is where the rubber meets the road. The final fund that is created is the Emergency Chronic Illness and Critical Illness Fund under Part 5 of the Act. So this one now, it's basically targeting chronic and critical illness. And it's saying that, okay, there are special conditions here that we need to focus on. Again, this one is not mandatory, just like the primary healthcare fund. And what the Act and also the regulations does not make clear is what is going on? What is going on between these 2 other funds? Okay. Does the registration in the Social Health Insurance Fund also entitled me to the benefits of this other fund, or must I register in this other funds? The Act is silent. Our appreciation of the regulations is still growing. Remember, a lot of us had disregarded this thing when we got to the safety net in the High Court decision. We decided, okay, we are not going to pay attention to this thing. Now it's here. Now we must interrogate it, and now we must understand it. So that is the structure, a structural setup of the Social Health Act, with the various funds that is creating in an attempt to answer to the question of universal health coverage.
Interesting. And that is quite some point. Now, you talked about something that then would give me another question to ask Duncan. The obligation of deductions or making the deductions is basically the employer.
Yes.
But we know that we are using technology. This process has been automated. It is not manual. And so even for the employers, they need to deduct and then do the remissions. It's the process is automated. And with all these challenges that we envision, from an employer perspective, Duncan, is there a framework that the Social Health Authority has created for employers to engage them through this particular transition period to address any teething issues or challenges or any problems that may arise to ensure that the process is seamless? Is there a framework or a platform within which the employers can engage the Social Health Authority to address any such emerging issues and challenges?
Okay, thank you, Eric. I think before I move to answering that question, I would probably respond to a question that Zach has put out there in regards to that every citizen of the country would be required to register under this particular program.
Yes.
So I was lucky enough to come across a podcast that basically had the director of this particular authority. And I think I picked something from that I thought would be very useful to respond to that question.
Yes.
So basically, he was saying that under the spirit of this particular act, as compared to NHIF, it is basically to register and address the issues from a household perspective as compared to an individual perspective. Meaning that all the members of a household are required to register.
Yes.
So that basically the government can be able to assess the household income. However, it is probably it's important for people to understand that the reason why they are registering is not simply to probably lead them to paying for each particular individual of that particular household, or rather than for the government to have a platform where they can evaluate the total income of a household. So moving on into terms of how whether SHA has provided a platform. So far, the only platform that we have been able to interact with is their website.
The portal.
The portal. So basically, you have the option of logging in as an employer. Luckily, they have not provided a lot of guidance on how you go about that. But luckily, from my team's trial and error, we have realized that the logging in credentials are the same as the one that we had registered under NHIF, which is basically the old platform. Secondly, we have a platform where individual employees can register. To date, I can confirm, as of this morning, I was not able to see the information of my employees who have registered, and therefore, so far, I've only relied on basically communicating with my employees and continuously advocating for probably them to log into that portal and register. And thirdly, I think the other issue that they have tried to address and communicate to majority of the employers is simply because they realize that we are using digital platforms even in processing payrolls and so on, to make sure that we make those adjustments in advance, of course, so that we avoid the penalties that I think Zach has already alluded to.
Okay. Yeah. So basically, it means that the employers have a lot of work to do in terms of navigating this particular process, helping their employees also to create their profiles, update their accounts, and all that kind of stuff. And because I was looking at the charts and the questions that are being asked by some of our listeners. Basically, you've addressed that because one of the listeners was asking, the numbers that have been listed there, if you call, nobody picks. So it means that even from employers' perspective, we must basically try and find a way that we can be able to navigate this particular transition and address any challenges. Zach, there is a question that is being asked by one of our, I want to go to the Q&A because in the interest of time. One of our listeners, Sharon Washira, has asked a very important question on the chat. How should we handle expatriates?
Yeah. So before I even answer that question, and thank you, Sharon, for that question.
Yes.
Before I even answer that question, allow me to correct something. I had mentioned the transition period is 60 days. No, it's 90 days.
90.
From the date when the act comes into force.
Okay.
So it's 90 days.
Yes.
And also, secondly, when you look at the funds that I've just spoken about the
Yes.
primary healthcare fund. And then, so the primary healthcare fund is read together with the Primary Healthcare Act 2023.
Yes.
And basically, under that act, then whoever is registered under the Social Health Insurance Fund
Yes.
will get benefit, the benefits under the Primary Healthcare Fund.
Yes.
So the registration under the Social Health Insurance Fund allows you to benefit from the Primary Healthcare Fund under the Primary Healthcare Act.
Yes.
And under the regulations, the Emergency Chronic and Critical Illness Fund also can be accessed. The benefits under there can be accessed also through the registration under the Social Health Insurance Fund. Now, the question by Sharon in terms of dealing with an expatriate. First of all, we said the Act is extending its boundaries as to who it covers.
Yes.
So it did not leave these people out. Yeah. So that it contemplates a situation where a non-Kenyan, basically the expatriate,
Yes.
is going to be is in the country for more than 12 months.
Yes.
They too can be registered under the Social Health Insurance Fund, SHIF, and be able to access benefits and that are provided under this package. But where this person is going to be around for less than 12 months, they're required to have a travel health insurance cover.
Yes.
So the Act has also thought of these people and has also taken care of them.
Yes.
And there's a framework for registration. They should be able to provide, of course, they fill out the registration document together with their passport, and the registration shall take place. When you look at Schedule, I think 3 of the regulations, there are forms for expatriates.
Okay.
Yeah.
Brilliant. Duncan, I don't know whether it is you to answer this or Zach. Is there any relief on SHIF? Any pay relief on SHIF? When you're doing the deductions, is there any relief?
Yeah, I think that's a question that I can respond to.
Yeah.
Based on the CPO interpretation of the Act and basically the communication from the government, so far they have just communicated that it's 2.75 of the gross. Yeah.
Okay, so that basically, I think also answers a question that has been asked by Lillian. Lillian is asking, is there a minimum amount that the 2.75% applies, or it applies to all employees irrespective of their gross pay? E.g., do we deduct 2.7% to even casuals whose pay is normally low? A very valid question.
Yeah, okay. Basically, the Act has just addressed that we need to deduct 2.75% of the gross, and this applies to all employees. However, it has gone further and explained in terms of people who are not formally employed, how they basically address that and evaluate how much each individual or contributor in a household needs to contribute. Yeah. So basically, that's the information we have.
All right.
Yeah.
Zach, there is another good question here, and this is basically based on the experience from NHIF. You know, with NHIF, there were several caveats, you know, as to which health facility you can visit and what, you know, benefits that comes with it. So is, according to the Act, how is this framed? Is it only government public hospitals or even the private health facilities where one can be able to get health facility?
So there's a general requirement for empanelment of health facilities, as it were.
Yes.
But these health facilities must register with the authority. So they are conducting a fresh registration exercise.
Okay.
Yeah. This is among the things that have introduced a bit of confusion because the initial rollout was only in public health facilities. And whether or not the other private entities had already started the process of registration and being empaneled onto this new platform is also now another question of transition. Yeah. The argument initially had been that they ought to have started with where NHIF had reached, pick the data that was there and continue with it. But the approach that they decided to take was to do and conduct fresh registrations and empanelments. And this Act provides criteria for qualification to be empaneled under the Social Health Insurance Fund.
Yes.
So it is a question in transition. So whether the other private health facilities have joined in, we're not sure, but what has happened is that now NHIF still continuing to run concurrently. It could mean that these services are still being provided.
Yes, I think that is a critical point, because in my little bit of research, I know NHIF is still running concurrently, especially when it comes to civil servants, the comprehensive cover.
Yeah.
So basically, it goes without saying that there are gaps here and there,
Yeah.
that even the authorities understand and appreciate that needs to be taken care of. I think this is a question that has been handled. I'm trying to look at other questions from the chat. There was a question about the transition period, and I think, Zach, you have corrected this. Initially, you had said 60 days, but you've corrected it's 90 days. So for the benefit of all our listeners and viewers, this act came into force on 1st of October, so it goes up until 30th or 31st of December.
Yes.
That is basically 90 days.
90 days.
And not end of November.
Yeah.
So I think that is the correct position. I think some of the questions that I'm seeing here, I think we have answered most of them. Mary Mudhoni is asking, what happens to information duplication, where team members received confirmation details that were incorrect?
They received confirmation details from the authority.
I'm thinking probably I have updated my details, and then the text that I'm getting back, the SMS that I'm getting back probably has wrong information. My name is not correct. My ID number probably is, the figures have been changed or something like that.
And these are some of the challenges that also existed in NHIF. Yeah. Because of a lot of falsified claims.
Yes.
And some of these things, people lost their IDs. And then you discover that you have been treated in Moranga, your leg broke, and they have treated you in Moranga. And you see, these were some of the gaps that were there. Yeah.
Yes.
That's why you heard when the Director General for the authority was explaining, one of the biggest selling points was we now have biometrics. Yeah. But these biometrics are going to be useless if they are not, are taken at the point of onboarding. Yeah. If they are not taken at the point of onboarding, then that biometrics is useless. Yeah. So how they intend to roll out this registration and cleanup systems,
yes,
it's going to be something that we want to watch closely, because the NHIF system had a lot of these gaps and a lot of this duplication of information. And one employer go to the other one, you've forgotten your NHIF number.
Yes,
you just create a new one, and there's nothing in the system to stop it.
Okay.
So there's a lot of that needs to be cleaned.
Okay.
And where a person is going through that, again, for me, my considered advice would be engage whichever way, send letters, do whatever, just try and engage. Have something on record that you've attempted to have this thing rectified.
All right.
And I don't know how reliable that information was, but I mentioned earlier that they had a problem with the system.
Yes.
There was information out there that the system was hacked, and I believe that might align to the question that viewer is raising. That the information that basically the information was almost corrupt, and I believe at that point that's where they stopped even the registration, that people started struggling.
Yeah. In the interest of time, I think we have had a very engaging discussion, but I want to give you 1 minute each to make your closing remarks. Duncan, as you make that closing remark, please answer this question. Should we also concurrently request staff to begin updating their beneficiary details on their portals?
Yes, I believe that's one of the requirements as stipulated, and the communication from the authorities.
Yes.
In this case, from this particular authority. And actually, I also picked a very funny comment from the director from the same podcast, that he was mentioning that currently they don't have staff.
Yes.
They are planning to onboard the staff from NHIF. So
Yes.
I don't know how they're operating. However, as I've been, both Zach and I have probably communicated, we need this act is basically trying to focus on the households. So basically, the dependent information needs to be updated for you to fully appreciate this particular program. And as I mentioned, I was also able to follow up that information for that particular director.
Yes.
And check from the act that some of the people who are almost basically exempted from contribution, basically is the spouse.
Yes.
If at all you have a contribution in the household, probably the spouse. If at all they are not formally employed, they won't contribute. We had children below the age of 21, and like the NHIF, where I think the age was capped at 18. We have anybody undertaking any educational program who is below the age of 25, and we also have dependents who are disabled. So those are the four people who are exempted from contribution, according to probably the question that Zach had raised. So in my closing remarks, of course, I would probably urge employers to look at it positively.
Yes.
We look on the brighter side of this particular act. I know the main concern is about the execution. I believe all the people that I've interacted with who has gone through the act and have read about the plan, they are kind of satisfied that it was done by competent people. However, we cross our fingers and we hope that the relevant authorities, in this case the government, is going to execute it in the best way possible. And of course, or employers can use this opportunity, probably if at all it's executed in the right way, to probably also withdraw some of the cost that they incur by providing that private health care for the
Brilliant. Thank you, Duncan. Zach, in under 30 seconds.
Yes. What happened to my 1 minute?
Okay, 1 minute.
No, 30 seconds would be enough. Yeah, I think for us, it's a question about risk and compliance.
Yes.
It is the law. The law is here. Whether we like it or not, this is the law.
Yes.
We must assess the risks, and we must map out our compliance journey. And once we've mapped out our compliance journey, we start on that journey diligently and be able to ensure that at all times we are mitigating any risks that are arising from this implementation of the act. Particularly, even as on the question of registration and updating the information and just making sure that there is sufficient understanding within the HR department, make use of your legal teams, and make sure that the knowledge and the information is out there as much as possible, so that compliance becomes a lot easier.
Yes.
Yes.
Thank you so much, Zach and Duncan, for that intriguing discussion.